are several factors that are currently driving change in the behavioral healthcare market. The first is in recent years, we've seen that people are talking much more freely about behavioral health conditions. There's much less stigma around discussing issues like depression, anxiety, substance use disorders. I think that people recognize that these are real healthcare conditions and not imagined issues or personal shortcomings, and so they're not ashamed to discuss it and to seek help for it. Another important factor is the recognition of comorbidity, which is the co-occurrence of the high level of co-occurrence between behavioral health conditions and physical health conditions. For example, patients who have chronic conditions such as diabetes or cardiovascular disease are much more likely to also have depression.
The Mental Health Parity and Addiction Equity Act was implemented back in 2008, but almost 10 years on, we're still facing challenges with implementing mental health parity and really achieving the goals of equal coverage for both medical services and mental health services. Some of the challenges that we've seen as coverage has expanded for those services is the lack of providers in this space and the need to provide access in ways that patients can feel comfortable accessing those services. So we've seen different drivers such as the use of technology to increase access and to allow for providers who are remotely located to provide services to patients in this space. And I think another area that's going to continue to drive change in this area is really the implementation of alternative payment models and the focus on value-based care.
The Centers for Medicare and Medicaid Services has already announced that they are looking for innovative ways to incorporate value-based payment mechanisms integrating behavioral health care and medical health care. Many of the state Medicaid agencies have also initiated value-based programs which will integrate behavioral health care with medical care. And then there are certain aspects related to licensure that states have incorporated, such as the Interstate Medical License Compact, which will allow a medical provider to provide medical services across multiple state lines.
There are quite a few legal and regulatory areas that have become very relevant and important. I would say the two most important areas are the need to comply with federal and state fraud and abuse laws and privacy laws relating to patient records. With respect to fraud and abuse laws, the main ones are the anti-kickback regulations and STARK requirements. If a behavioral health provider is receiving reimbursement from Medicare, Medicaid, commercial payers, they need to train their employees as to what they can do to generate referrals and what they can't.
If behavioral health services are provided by through behavioral health services, it's important that the provider be licensed in the state of the patient. And so a telebehavioral provider who's going to be providing services across multiple states may need to be licensed in many different states.
Providers are really being encouraged now to take on risk, to manage a population of patients and to focus on that population's health. And the goal is to truly integrate care between all of the providers that serve a beneficiary. So if a beneficiary has mental health and physical health care needs, under an alternative payment model, they should be able to really be sort of transitioned through the system in a seamless manner.
It's staggering to me that 55% of counties in the United States, most of them rural, don't have any psychiatrists, psychologists, or social workers. And one way to address this, fortunately, is through telemental health. And telehealth lends itself particularly well, fortunately, to addressing behavioral health issues because a physical exam usually is not required.
There'll be further integration of behavioral health care into primary health care. So when you go in to see your primary health care provider, there may be a behavioral health care provider just down the hall, and you'll be able to be referred immediately and see that behavioral health care provider. In addition, there will be further expansion of telebehavioral services through an expansion of web-based and computer-based technology.
But that also raises legal challenges and concerns for providers who are taking on this type of risk for the first time and really learning for the first time how to truly manage a population of patients. And so that means that they need to focus on contracting. Who do they partner with? And what do those contracts say with respect to the services that are provided and how they achieve goals such as reducing costs while maintaining high quality. And so providers need to focus on making sure that they're in compliance with the traditional fraud and abuse laws that have been around forever regarding kickbacks and beneficiary inducements, and making sure that they're not reducing care to patients in order to save money and to achieve savings, bonuses, and rewards for the care that they're providing, and to really focus on how best to treat a patient so that they are overall, improving the health care of that patient, both on the physical and mental health side.